a postpartum mom pushed for 3 hours. You were providing care for her 4 hours after a vaginal delivery. The nurse notes blood loss of 900 milliliters. Per protocol, the nurse increases the IV fluid. The nurse understands that the patient may be in this state. No, you go. Go ahead, answer.
What is postpartum hemorrhage?
Anyone? Oh, sorry, we cleared. Cleared.
What is hypovolemia?
What is hypovolemia? 600 for big money, yes, yes.
No. That's not there. Oh, yeah? Okay.
Because you read it fast enough, I'm just still gonna read it for everyone. Everyone got that? All right, let's go back. What was our clue here? She increased the IV fluids. Did we increase IV fluids for hemorrhage, for bleeding? So that told us she's hypovolemic, right? Does that make sense to everyone? Someone said no, I heard. That's fine. Big money BSMs, what's our category? Hold on, sorry. Is it not sharing my whole screen? Oh, it is. It's just a delay, I'm sorry. Big money BSMs?
Big money.
Come on.
Newborn complications, 1,000.
Yeah, go ahead. All right. Sorry, There we go. Prolonged exposure to oxygen and ventilation can lead to this condition in a newborn. Do we say it again?
What is retinopathy?
Oh, I thought we said. Is there anything you want to add?
You still have to push for the answers first.
Did you hear? Are you accepting that? Okay, so we're gonna accept that. What is retinopathy of prematurity? The point is, if y'all saw that again, you recognize it? Red. 1,000 for red.
If you know the answer, you can hit it.
Yeah.
It doesn't, you don't, whoever asks the question, you don't get first dibs. You ask the question because you got it right. So next time, they're gonna ask the question. If you know the answer, hit the buzzer. And then if they get it wrong, we go to whoever hits it next first. Yeah, I watch Jeopardy. So good.
Red team, what, category and dollar amount?
Maternal complications, 600. Can you clear the light?
Oh, yes, sorry. Thank you. Frequent and effective breastfeeding can prevent this.
Red. BBLRNs.
20 seconds, right?
Yeah. Frequent and effective breastfeeding can prevent this. Time's up.
What is mass
Are you accepting that? That's why y'all gotta say, that's why the time.
Let's just skip it.
Okay, y'all ready? What is the answer?
What is math
When you press it, know the answer.
Do y'all see an extra note on there, an extra helpful note for you? Is it safe to breastfeed with mastitis?
Yes.
Okay. So this might sound like a multiple. So you saw that, you remember that it's safe to breastfeed, and then what was the main point of it? Frequent and effective breastfeeding, it goes to purple. Y'all got, that's why it's the, you gotta answer before the budget. Yeah, y'all don't know the answer, does it?
Yeah.
But that's why they ran out of time, because they didn't have the answer ready. Woo, y'all are, I'm very honest.
Yikes.
All right, purple. Done. Interpartum for 400. The nurse observes early decelerations in the fetal heart rate. The nurse knows that this may be due to purple. Huh?
Purple thunder.
Oh, y'all have it.
Yeah, you said.
Form of a question.
What is?
Oh,
what is?
What is placenta insufficiency? Yeah.
No, when you get it wrong.
It don't work. Well, it clearly don't work. You've been over here pressing 5 minutes.
Say it.
No points on that one, but get the answer.
It's not placenta.
Sorry, because I actually did.
It's not prolapse. You tell me what's prolapse cord. What is veal chop? Wasn't that on y'all?
Yes, I know.
We know it.
Remember veal chop?
Can we get another cup of book?
Can we get a
It's
recall?
not
I
working.
don't think so. Nobody got. Can we get a recall?
It was over here. It wasn't working, baby.
You better hit it.
And I'll someone else.
Don't give me that bad
All right, everyone gets the answer to that?
Y'all understand the answer?
Early B cells are due to head compression. Okay, no buzzer right now.
I'm sorry. I just want to make sure.
It's okay, it's for you to learn. A little competition, but it's for you to learn, as long as you saw the right answer. No one got that one, who was, you guys selected the category? Go ahead and give us another one. Just give us something.
Miscellaneous for 400.
Miscellaneous for 400, all right, let's go. A client with a family history of breast cancer and is positive for this gene should have an MRI and mammogram annually. Big money BSN.
What is the BRCA1 and
You said what is a BRCA1? 400 for blue, are they on the board? Y'all know the BRCA1 gene? Remember, if they have a family history of breast cancer and they're positive for BRCA, they have to have an MRI and mammogram annually. Every year they do one.
No.
Okay.
Just in case someone told me.
Big money, BSN.
Category, dollars.
Quickly.
Postpartum 1,000.
Okay, go big or go home, big money. Postpartum 1,000. Which stage of labor does the uterus? Which stage of labor does the uterus rise into a ball shape?
The placenta comes up.
Big money, BSN.
What is the fourth stage of labor?
No. Next.
Yes, no,
Emerald.
What stage 2 of labor?
No.
What is stage 3?
Yes.
There's some extra little notes on that one.
Cause what stage is this?
Third stage.
What are we about to, what's about to happen?
What happens on third stage?
Delivery of the placenta, very good. Yes,
Are
ma'am.
there extra notes on here?
Yes.
Should y'all be taking notes of the extra notes? Y'all know them extra notes.
This is all what would happen. So know what will happen.
You had a
So
question?
there might be one
When
that's
you
not
get the question
gonna
wrong,
happen,
don't
right?
you lose points?
No.
No, we're not taking any points away, but in real Jeopardy, yes.
It's kind of lame, but okay.
All right.
Well, they got it right.
Everyone.
They didn't. They should lose points.
No, once
Hey,
we
we got
start
wrong
getting everyone on the board, we'll start doubling. It'll be double Jeopardy. All right, everyone got that one. Okay, the buzzer is cleared. Red, what category are you guys going for?
We'll do miscellaneous 800.
Okay, miscellaneous 800. Buzzers are cleared. This is the main cause of cervical cancer.
What
Red,
is HPV?
very good. What is human papillomavirus?
Hey,
Y'all, the point is you learning something, and that you're gonna make your study notes off of, right? We said,
You're already 12 minutes in.
think of your category, if you don't.
yeah, RN.
Miscellaneous 600.
Okay. Buzzers are clear. Symptoms of this infection include profuse, frothy gray or yellowish green vaginal discharge with a foul odor.
Purple thunder. Y'all get your answers ready, 'cause they. Okay, next.
I did.
Next. Blue.
What is today?
Yes.
How much was that one?
600. Y'all be thinking of the next category, please. Remember trichomonas has that frothy gray, greenish yellow, and it's very malodorous.
It's grody.
Know
Do you
that
remember the slide
STD
Dr.
chart.
Washington showed y'all? Of that trichomonas under the microscope? Everyone
No.
saw the description?
Know that STD chart. I beg of you.
All right, guys, keep thinking of category and dollar amount.
Blue. Next.
Newborn complications for 600.
Newborn complications for 600. The absence of lanugo is expected in these newborns. Blue.
What is preterm?
Or accept that. Preterm?
No, hit it again.
Oh,
Clear it. Is it?
y'all already answered this one. Sorry, let me go back. Heads down. No, but that's not the right answer. I know, I'm trying to stop sharing and go back in it. I need to be at my other school where I'm unplugged it.
Please help.
It's not because it's sharing my whole screen. Okay, so I want y'all to go with the answer though.
Okay, I get it. Can we answer?
Yes, exactly.
What is post-term? For the
Yes.
lanugo?
Post maturity is the answer. Okay, good.
You can still see on the screen.
I know, no, I need to stop sharing.
It's over, it's on Jeopardy now on the other screen.
Oh, I know. Yes, post maturity. I like the connection to what's up going on. Y'all ready for CPR? That was 600, yeah.
What do preterms have?
Burnish.
They have excessive, a lot of living.
They're like see-through.
Post
Who got that one?
red.
They taking care of BBL patients, they get cash. Big rush.
Ain't no wrong with it. Ain't no wrong with it. Do what you wanna do. You got the money.
And I know which stuff. If it was already selected.
Not auto because I'm not
He's like Peter,
Oh, I
8,
thought a hot
9,
That'll be fine.
X,
Yeah.
E.
It's just this computer. It's exactly not gonna get that restarted or something.
Do y'all have drinks or you need a break real quick? Y'all ready to keep going? Okay. Shoot, I didn't even I was like, no.
There's miscellaneous 1,000 too.
Y'all are doing good. So now, don't be freaked out if the board
I was
is
just saying.
not clear.
I think we do
If
pretty
y'all
good with the
select
1,000
category
ones.
that was already
Those are
selected,
usually our jam.
we'll know that we saw it already.
So,
So,
BBL,
so if we see, if we've already seen the question, you get to pull another question. Does that make sense?
Miscellaneous 1,000?
I think we got 1,000.
Was it done?
No, this is a new question. The tertiary stage of this STI has symptoms that are related
What is syphilis?
to damage of internal organs. Yes, you got that right. The tertiary stage.
I told you guys 1,000's our jam.
Right? Does that make sense? Y'all remember, it's your only STI that has stages. So if you need to match this one, you already automatically know it's syphilis, right? Yes.
Okay.
Hey, we're not losing points.
That's true.
Everyone see the description?
Yes.
What's your category, Red?
Can we?
See?
Antepartum, 1,000?
Antepartum. The fetal heart rate has dropped significantly following the amniotomy. The nurse should immediately assess for fetal heart rate.
We learned it.
Blue.
big money.
What is prolapse score?
Very good. What is umbilical cord prolapse? What category, dollar amount, ladies? So, everyone see this scenario?
Because of the fluid, that's why we wanna make sure the head is engaged, so the cord don't come out.
Category?
Intrapartum 1,000?
Intrapartum 1,000? Alrighty. The nurse understands that this cardinal movement is presented in the picture below. What cardinal movement is this? Purple.
What is external rotation?
Very good.
Okay, okay. Very good.
And this particular picture is in y'all's book.
Yeah.
Be familiar with that position. The face is facing us and the head is coming out, right? External rotation. Y'all got that one? Category and dollar amount, please. I'm just hitting slowly so that it starts taking over.
Newborn. Oh, yes, it's, newborn complications.
Okay. Small underdeveloped alveoli can cause respiratory distress due to insufficient levels of this.
What is surfactant?
Very good.
It's so much trap out.
200.
Okay.
Yeah, we're gonna still win. All right. Dollar amount and category.
Postpartum 200.
Postpartum 200. The following is an early sign of postpartum hemorrhage and requires immediate nursing intervention. So this is during your assessment. Green.
Oh, you brushed it.
What type of?
No. Next.
What is Golgi
Bulging. They're still within time. What is a body uterus?
I was like, I didn't know what you were trying to say.
Does that make sense to everyone?
Body uterus.
Body uterus is a sign of postpartum hemorrhage. So what do we do?
Massage.
Because what was y'all's answer? That's a late sign, right? That's not early. We're seeing changes in their vitals, we're behind the 8 ball.
Well, at least it was a sign.
Category. And I think postpartum 1000 is one we've already seen, but let's see. If so, we'll look. I tried to click her. It's not right. Yeah, so we've already seen this one.
What stage?
3.
Good job. All right, can you pick another category?
I think we did all of that.
Blood pressure equal to or greater than 140 over 90 with onset of grand mal seizures is called what, blue team?
Blue?
What is eclampsia? Very good. If you guys can give me a category and dollar amount. Y'all see, make sure you're looking at this.
So, now, y'all should know the differences of hypertension throughout pregnancy. Did she have it before pregnancy? What is that called? Did she get it during pregnancy after 20 weeks? Does she have seizures? Know all of the categories.
You may have to match them up. I don't know.
Just saying, see the test.
All right, guys. So what category and dollar amount, please? Blue.
Miscellaneous 800?
Miscellaneous 800.
Did we do that one?
Seen that one. Yes, we've already seen that one.
I don't know any of those.
You gotta pick.
What is the main cause of cervical cancer? Y'all remember that one, right?
Yes. Next.
Can I have something else?
400?
400? Okay. We get that one. What was the answer to that one? Broca one. It was the Broca one.
I guess, antepartum 400?
Antepartum 400?
Yeah.
Okay. A nurse anticipates placing an IV and administering IV fluids for a client with severe vomiting in early pregnancy.
What is
This condition is known as,
hyperemesis?
what was it? What is 400. What is hyperemesis gravidarum, right?
Okay. Study, somebody,
Let's hold on, just slide us a quick one.
We just ain't hitting the buzzer.
Just slide us a quick 50.
All right, can I have another category? They got it right? Okay. Ladies?
Okay, intrapartum 600?
Intrapartum? A potential complication after an epidural. Green team.
Hold on, wait a minute, hold on. Is it that?
What is hypovolemia?
Purple. After an epidural, what are they?
What is a headache?
What kind?
Epidural headache.
What is the spinal
Complication of epidural hypotension, that's why we give the bolus of fluid, or?
You don't always give a bolus of fluid after an epidural.
Oh, no, you give it before to prevent hypertension, right?
That's not a standard. A doctor may order that, but a serious complication is a spinal headache. That's why we have them do what after if they start developing this, they get the blood patch, we lay them flat for so long.
Oh, okay.
So, yeah, this is something that any nurse, I had a student from my adjunct facility take board yesterday. She said, why was it full of OD and cardiac?
Oh, wow.
The two things she hated. Spinal headache is expected for every nurse to know this as an epidural, because you do epidurals or spinal taps in other areas of nursing too, so just know that anytime we're using that, right? All right, you guys got a category, I'm clearing for purple. Category. Oh,
Maternal complications for
this is inflammation of the breast tissue that can occur during breastfeeding.
What is mastitis?
What is mastitis? No, you do not have.
We had a different one.
Oh, the question was different, okay.
Yes,
Can you go back to the question?
yes. Does everyone see that there's extra note here for you?
Well,
Signs of mastitis include redness, pain, and swelling, and I will go back to the question for y'all too. Mastitis is inflammation of the breast tissue. Y'all good? And remember those other notes of mastitis that may all kind of go together, so you got little extra nuggets there, okay? Can you pick a category for us?
maternal complications 800.
Okay, I think that one was picked, so let's see. No, okay. Maternal blood pressure equal to or greater than 160/110 What is this called, purple team?
What is
Buzzers free? Blue?
What is it? I think when you doing that, it's turning it on and off.
No. So look, what is severe preeclampsia? Maternal blood pressure of equal to or greater than 160 over 110.
What is hypertensive crisis? They get to answer twice?
No, that's just a negative for everyone, but that's hypertensive crisis. Does that make sense? Look at that blood pressure. Where the crisis is at, can we leave anyone at equal to or greater than 160 over 110? No, that's urgent. That's a urgency of crisis, right? We've gotta get that blood pressure down. Pregnant or not. That's a hypertensive crisis. So y'all, I'm gonna go back to you, y'all can see those numbers in case you see those numbers again and you can match it correctly, right? Greater than or equal to 160 over 110 is a hypertensive crisis. Category. Thunder, boards cleared, or lights are cleared. Postpartum 800, I think we may have done this one. No. So this is post-cesarean. Immediately following a cesarean delivery, the nurse should assess this system of the newborn. Purple. Very good. What is respiratory system? So after a C-section, that baby wants the most important system to get to assess first. Respiratory system, very good, guys. Okay, buzzers are clear.
Yeah, doing so good.
I'm very impressed, yeah. Can we have it?
Go ahead and say you went proud
It's the buzzer.
Yes, we are.
I don't hear it. Yeah, we heard between the lines. It's all right. It's okay. We heard between the lines.
Antepartum,
We'll make up with our
800.
Say that again, baby.
Lab results of hemolysis, elevated liver, of a
What
farm,
is HELP syndrome?
and low platelets. Sorry, I left the R off that one. Okay, you guys are right. What is HELP syndrome?
Always when you try to do it at home.
Not yet, no.
Can I have another category?
We'll do antepartum 600.
Antepartum for 600, let's go. Folic acid is important to fetal development during pregnancy to decrease the risk of what, Publicine?
What is spinal fluid?
Y'all are rolling. What is spina bifida? We need like 3 more minutes. All right, are y'all ready to start doubling points?
Yeah.
Y'all are ready to start doubling points? So whatever category you choose, whoever gets it right. Board is clear. Buzzers are clear. Okay, for 1,200 points, or $1,200 from Dr. Washington.
Yeah, we already did that one.
The postpartum for $800. Ready? Listen. This process of the uterus returning to its this is the process of the uterus returning to its pre-pregnant state. What is uterine? You saw it on the paper. What is uterine involution? Does everyone see what's going on in that picture? I want y'all to take a picture of this. So, uterine involution is when the uterus should be going back down to its pre-pregnancy state, correct? Y'all good? All right, can I have a- So they got 800 for that, right? Double in points. Buzzers are scared. Okay, for 800 points here. This is a raised bruise area that covers the left and right portion of the newborn scalp. Green team. Buzzers are clear.
What is the consequence?
No. I'm sorry.
What is cephalohematoma?
No. Y'all are on the right path.
What is capet?
That, so I can go back and read the description. It is a raised bruise area that covers the left and right portion of the newborn scalp. Got it? Can I have that? No. Oh, they did. Blue dot.
Yes, 800. Oh, no. Oh,
Double, it was double with one.
No, not it.
Blue got right. Blue team, big money, BSN. What category? Yeah. ID. What category?
Newborn complication 600.
Okay, so for $1,200. Oh, here it is. Okay. Y'all want to pick another one, please? Is that 2 more double and we're gonna start triple?
No, that's not just.
Forward for 800. The following oh, I can't give this one to you because it's
Exactly what?
This is where we went, so I will read it, but it's not gonna be for points, okay? The following respiratory sounds are a normal finding in the newborn in the first hour of life. Everyone can say it. Scattered crackles. Remember, that is a normal finding in that first hour of life after delivery, okay? Now, we're talking 12 hours after delivery. We're reporting that, right? Now, I just want to be fair on the points.
That's when it all went.
Yeah, but okay. Can I have another, who chose that one, you guys?
Maternal complication 600.
600, so we're double points for 1,200. Oh, we already went over that one. Okay, pick another one for me. So I think that's the end of the ones where we came in.
1,000 though, I think we also did that.
Yeah, I think we did 1,000.
Do y'all want this one?
Yeah.
Okay, y'all ready? Can I do this one, the 1,000? Yes, we did do that one, you're right. That was all this one. Yeah, retinopathy of prematurity. Okay, now we should move back to regular mode. Another category?
Intrapartum 400, powerful.
Intrapartum. What? 400. 400. Nope.
Oh, we had something.
Clear, y'all ready?
Intrapartum 800.
Intrapartum 800. Okay. The laboring mom questions if this will prevent her from needing a C-section if it does not work during the vaginal birth attempt. Purple.
What is trial of
What is VBAC, vaginal birth after cesarean? We can't do it again?
But let someone else give it a turn. I'm clearing the buzzer, but I'm gonna get Blue.
What is epidural?
No.
Okay.
Read. Y'all want me to read it again?
No. Can I read it again since everyone's gone?
Alright, y'all ready?
Can't be
Guys?
sure get the point.
What is vaginal I knew y'all knew this. We were wondering if y'all would be thinking along this line, so I was gonna read it again with emphasis on certain words. It's wrong. The question is, this will prevent her from needing a C-section. They think if they agree to let you go ahead and use the vacuum assisted, it's gonna work and they won't need to go. So that's, but it's not a guarantee, right? It's just an attempt at a vaginal delivery. So, but for, test taking purposes, I want y'all to make sure you're reading the question and understanding the right? Prevent her from needing a C-section? No, it won't necessarily prevent, but it's gonna be an attempt to free one. It's probably your last ditch effort to get this vaginal.
Didn't work for me, it helped your I got a C-section.
Yeah. It's not always guaranteed that you're not gonna have a C-section, is what we're trying to teach her. Y'all got that? Yes. All right. Almost done, guys. Woo, look, we can see the word. Y'all want a triple now?
No.
Yes.
Okay, can I have a blue selected that question? Can I have another category?
Miscellaneous for 6.
Oh, we did that. Another one? That's the, trichomotor.
Miscellaneous 2.
A history of this is a contraindication for estrogen
What
therapy.
is DVT? It's the deep emblem.
A history of this is a contraindication for.
Osteoporosis. Oh, what is osteoporosis?
No. Purple. No. Green, any guesses? Y'all know this.
I mean,
I'm about to go to the
it's
answer.
not the answer, but
The thromboembolism or whatever.
that's a correct answer.
Yeah.
This is for your exam, remember?
I'm gonna go back to my question, right?
For your exam.
A contraindication for estrogen therapy is a history of breast cancer. So you can't have even a family history. If your sister had breast cancer, do you think a doctor is gonna start you on estrogen therapy? If you're not that history. All right. For 600 points, we'll triple. Can I go ahead and go maternal complications? Feelings of sadness between tearfulness during the postpartum period. Blue.
What is postpartum depression?
Not depression. Clear.
postpartum blues.
Very good. Competitive nurses. Look, when they graduate, I'll get them.
I know. BBB.
They're like, you're not a clone, I'm gone.
Go.
I mean, I'm just like.
So why is it not depression yet?
That's been long enough.
Okay, very good, I want y'all to. And that's not gonna be a trick question, but I just was asking why not depression. Okay? I'm gonna go interpartum, you gave them 600 points for that, okay. A delivering mom who had a previous C-section.
What is a
once they
VBAC?
took labor in hopes for vaginal delivery with this pregnancy is referred to as.
What is a VBAC? Vaginal birth?
It's TOLAC. It's TOLAC.
Yo. Oh, that was at the same time?
Yeah.
And so we chose for them.
Oh, wow.
What is it?
What is it?
Very good. So there was a key word in there, ladies, that I was taking tests. And if you saw this on NCLEX or HEI, the key word was attempt. She had a previous C-section, but wants to attempt labor in hopes for vaginal delivery with this pregnancy. This is referred to trial of labor after cesarean. Right, Dr. Washington?
Yes.
Y'all got that? There was a key word in there. All right, last one. How are we doing on points?
Don't you look.
All right, ladies, here we go.
You got enough for you.
Because now we have to know this question, okay?
Oh, we have a bonus, yeah, that's for one.
One person is gonna be able to solve it. Okay, so if a pregnant client's results are greater than 135 on the 1 hour oral glucose tolerance test, the nurse would educate the patient to return for one additional test.
3.
What is a 3-hour glucose tolerance test?
Not been coming.
Do y'all want to take a quick break before now you guys are individually gonna go for the big prize. We'll add this up. Do y'all want to break before, or you want to go ahead and get a piece of paper and stuff out?
Just finish it off.
Y'all want to finish with a break? So here's paper if someone needs something to write on, and I got pens. It's not math. It's not necessarily math. Everyone can have a sheet of paper.